TRT fam, Justin again reporting from Tennessee, and today I've got a special request from Dr. Devos himself. He says he gets countless DMs every single day about clients, about patients inquiring about berberine. So that's what we're talking about today. We're talking about berberine. Without further ado, let's go. So one of the primary uses, or the most well-known use of berberine, is its actions as a glucose disposal agent. And just like metformin, berberine also participates in the AMPK pathway, and it does this in a dose-dependent fashion, meaning smaller dose, less expression in the AMPK pathway, larger dose, more robust expression. And I previously discussed about metformin and the AMPK pathway in a previous video, and I've also discussed how this pathway kind of acts like as a quote-unquote a caloric restriction mimetic. Also activating the AMPK pathway, it also increases insulin sensitization and the uptake of glucose, both into skeletal muscle and into adipocytes. And it does this primarily through acting through the GLUT1 and GLUT4 activation. Now just FYI, GLUT4 would be the primary transporter, and GLUT1 is just kind of small scale. Besides AMPK pathway, there's a multitude of pathways how berberine can act as a glucose disposal agent, but another primary pathway is the GLP-1. So berberine does have some GLP-1 like properties. In fact, it can actually increase GLP-1 expression. Now, the best available GLP-1 on the market currently is semaglutide. Now, I'm not saying that berberine can even hold a candle to semaglutide. That's not what I'm saying. I'm just saying it can work as a GLP-1. So GLP-1s, aka glucagon-like peptide 1s, are peptide hormones, and they work by stimulating glucose-dependent insulin release. Hence, they are not notorious for causing hypoglycemia, because excursions in glucose must be present for GLP-1s to exert their effects. Again, GLP-1s are glucose dependent. Also, furthermore, GLP-1s work by slowing down gastric emptying. Thus, you can eat less, stay full longer, and it takes longer for food to go through transit because, again, it's slowing down that. Now, berberine can also lower LDLs. There's not a lot of literature supporting it, but from what little I've found, it works kind of like a PCSK9 inhibitor. And PCSK9 is an enzyme, proprotein convertase subtolysine 9. That's PCSK9. So it appears that berberine can lower LDLs, again, in a dose-dependent fashion, roughly about 25% reduction over a 3 to 4 months time. Now, PCSK9 is an enzyme, and what it does is it binds LDL receptors on hepatocytes, and it degrades those receptors. So by blocking PCSK9, you have all these little LDL receptors on the surface of the liver, and they can readily grab LDLs from serum, bring them in for disposal. When PCSK9 is abundant and available, PCSK9 it binds those receptors and degrades them. Therefore, those receptors are no longer available. By blocking PCSK9, you've got all these receptors that are still available, still readily available to grab LDLs and bring them in for disposal. So, I hope that gives you a little more insight onto berberine in terms of how it can work with lipids. In terms of tolerability, the biggest side effect that most people deal with when taking berberine, well, it's none other than the same type of side effect you may get if you're on metformin, and that is gastrointestinal distress, namely like nausea, diarrhea. That's pretty common. But you can mitigate that by taking with food or taking lower doses and splitting it up into 2-3 times a day doses. Berberine also interacts with cytochrome 2D6 and 3A4 and 2C9 pathways. So if you're on medications like the macrolide antibiotics, such as like azithromycin or grapefruit can interact with that, or statins can interact with that. It may be something that you want to err on the side of caution. So again, for the most part, berberine is well tolerated and has a multitude of positive metabolic effects.